Let's talk about why data can be missing. Now, to decide whether a complete case analysis would lead to bias, it's helpful to understand why the data are missing. And there are broadly three missing data categories, which are missing completely at random, missing at random, and missing not at random. Let's dive into them. We'll start by talking about missing completely at random. Imagine a physician were deciding whether to record blood pressure measurements, and the way they decided was every time a patient came in, they flipped a coin. If the coin came out to be heads, they would record the blood pressure, and if the coin came out to be tails, then they wouldn't record the blood pressure. So let's go through this example where we have patients come in, and let's simulate we're the doctor. And the first patient comes in, and we flip a coin. The coin comes out heads. We record whatever their blood pressure is. Second patient comes in. We flip a coin. This time, the coin comes out to tails. We don't measure their blood pressure. Might come up heads again, tails again, and so on and so forth. And now, with this mechanism, we can think of what would our graph be in terms of the frequency of the different age groups for those with blood pressure missing and those with blood pressure not missing. Since we're not deciding whether to record blood pressure measurements by looking at a patient's age, we'd expect these two distributions to be very similar. So let's say if the patients we were looking at were uniformly distributed across all ages, we'd expect that for those with blood pressure not missing, we would also see a similar uniform distribution. Of course, this doesn't have to be uniform. Maybe we saw a lot more older patients than we saw younger patients, and here we would expect a very similar looking curve. We're going to contrast missing completely at random with other missing data categories, because most missingness is not going to be completely at random. So notice that for missing completely at random, the probability that a blood pressure was missing for any particular patient was constant. It was just 0.5. And this is what missing completely at random is. It's that the missingness is not dependent on anything. For missing completely at random, a complete case analysis, such that the one we did earlier, does not lead to a bias model. So we expect that when we have missing completely at random data, we won't create bias models. But most missingness is not completely at random.